Welcome, dear friends. I'm Dr. Manjunath, and today I have the privilege of talking to one of the most eminent speakers in entire of India, and that happens to be Dr. Jaydeep Choudhury, and he's an infectious disease specialist based out of Calcutta. So, and I have the privilege, and I'm extremely thankful uh, to to oblige my request to present something for my channel. And today he'll be speaking something about the rabies. So here we go. Over to you, Dr. Jaydeep Choudhury.
Thank you so much, Dr. Manjunath. It's a pleasure to be interacting in a scientific platform. And of course, when the topic is rabies. Now, there are few factors why I selected the topic rabies. Number one, nowadays we are coming across a lot of reports of human animal conflict due to various reasons. Most of the time, children are the victim. There are many instances then even people are getting frequent exposure to pets because now the tendency of having pets is probably more. And more importantly, World Health Organization has accepted the fact that to control human rabies, we must have the One Health approach because we cannot segregate the human rabies from the animal rabies and from the environment. So the preventive approach and also awareness approach should be holistic, covering the environment, the animal world, and the human world, because these three aspects are inseparable. So that's why, while talking about the One Health approach, it's not only the control and management and prevention of human rabies, it's the control of animal rabies also, because until and unless the animal rabies is controlled, you cannot control human rabies. And there is an environmental factor also. We must be more aware that even while discarding the garbage, discarding the unconsumed food, we must be more aware because that's how the animals come into direct conflict with human. So this awareness is very important, and especially children. You just imagine a 4-year-old child going to school, and sometimes the child may be playing in the field or just waiting outside the school gate to get into the car, and inadvertently the child is exposed to an street animal, might be in the form of a minor scratch, because the children are often curious, they go very close to the animals, or there may be a lick, and that's an exposure. And the child might come back home and may not report the incidents to their parents also. So that exposure may go unnoticed, and it is an exposure. So this awareness is also important, that how to do it. Of course, pre-exposure prophylaxis of the children before they go to school or go out unsupervised is an aspect that we can think of and we can consider. But there is no as such guideline or recommendation about routine rabies pre-exposure prophylaxis. It can just come spontaneously, and as a pediatrician, we may suggest this to the parents also. Even those who are having pets, those children may be given pre-exposure prophylaxis also, just as a protection. And then the awareness about which animals can transmit rabies, which animals cannot. There is a lot of confusion. Many people think that dogs are the sole offenders, but no, all warm blooded animals may transmit rabies, including cats, including cattles, not talking about wild animals, the domestic animals. Probably the only exception, few exceptions, are rabbit and small house rats. Squirrel is a questionable. There are conflicting reports about squirrel, but probably squirrels are also not that offenders. Bat rabies is not seen in India. Birds and reptiles, they do not transmit rabies. So this idea is also important because some of the times the parents get very scared when a domestic rat also bites a child, but they can be assured, sorry, reassured that the domestic rats do not transmit rabies. Field rats, the city dwellers usually are not exposed. Field rats do transmit rabies. So this is the awareness part.